Hello, and welcome to this special interview in the Advocacy Exchange. I'm Dave Craig, CEO of Grit Health. I'm also a patient, a caregiver, and a patient experience researcher. These interviews and conversations we have are deeply meaningful to me in all of those areas because each time we learn something new from the experiences people living with a diagnosis face, and then how we can work together to improve outcomes. Today's session is also very special to me because it's an advocate hero that I've admired for several years. And so we're honored to have this conversation today with Mellanie True Hills, who's the CEO and founder of StopAFib.org. Hi, Mellanie.
Hi, Dave. What a
Oh,
pleasure it is to be with you today.
we have a couple years of experience, and I'm so
Yes.
excited to create this together. Mellanie, we always like to start just kind of understanding the personal journey and personal story. So, what can you share with our audience today?
Well, Dave, mine mostly started about 20 years ago. I am a heart patient. I actually had a stent procedure for 95% blockage back in 2003. And then later that same year, I developed atrial fibrillation, which is an it's basically it's called AFib, and it's the most common irregular heartbeat. And it can lead to blood clots that can be launched to the brain and cause a stroke. It increases your stroke risk by 500% and can lead to heart failure and even to dementia. Well, I had a minimally invasive surgical ablation procedure within the first 2 years of diagnosis. And now I've been AFib free for more than 18 years. But once I was AFib free, I knew that I couldn't stand on the sidelines and watch other people suffer like I had. So I started a nonprofit patient advocacy organization in 2007 called StopAFib.org. And our role is to help those living with AFib, including their family members, to learn about AFib and how to manage and treat it, and even how to get rid of it. We're proud to be the top arrhythmia site worldwide, and we have traffic from more than 200 countries. And our content is translatable into more than 100 languages.
Melanie, what was it like when you started that journey? I can only imagine how overwhelming a diagnosis must feel.
It absolutely was. I had never heard of AFib before. And here, all of a sudden, my heart has a mind of its own. I could be doing something like leaning over to pick something up or washing the dog, or, I could just be standing. And all of a sudden, my heart would take off racing and I would get dizzy and lightheaded and, might even have to go sit down. And it was really frightening to have that happen, especially knowing that it could lead to a stroke at any time. And at the time, I was never stable on the blood thinner called, oral anticoagulants that we AFib patients take to help prevent strokes. And so I felt like I was literally a stroke walking around waiting to happen.
I know that through that many years of a journey, things change, right? There's the initial diagnosis, and then we kind of feel like we have things conquered a little bit, and then something new happens. What has it been like to go through that whole journey now?
It has been a long time. And so a lot of the nuances of going through it have changed because at the time, there really wasn't any information. I got what my doctors told me, but that was 20 years ago, and doctors weren't always very forthcoming with the amount of information that you need in order to manage your AFib. So my doctor, when I was first diagnosed, told me, "Oh, just go home and live your life. You'll be fine." But I wasn't fine. I never knew when the AFib beast was going to strike, and it could disrupt my life and my family's life too. And I was afraid to go anywhere by myself for fear that I'd be off by myself and have a stroke. So it was a really frightening experience. I tried to learn what I could learn about AFib, but there just wasn't much information available at the time. So that's why I felt like when I found myself AFib free, that I needed to help others who were facing that same experience to figure out what they needed to know in order to get control of this.
So now you have built this organization and you get to support people's lives through that journey. Please tell us about StopAFib.
Thank you for asking. We launched our website in early 2007. And that summer, I realized that we needed to do more to raise awareness of AFib because a lot of people were undiagnosed and walking around as strokes waiting to happen. So when I started the organization, I knew that AFib was the most common unknown condition and decided that September should be Atrial Fibrillation Awareness Month. Well, you declare it, you celebrate it, and then you get it registered in the official register. And once I did that, then I started working with the medical societies and spending days on Capitol Hill meeting with our legislators until we got the U.S. Senate to declare September as National Atrial Fibrillation Awareness Month on September 11th of 2009, and that was by unanimous consent.
Please. So what kind of programs do you do now as an organization?
Well, first of all, we're global in scope. So
Mhm.
we have our Get in Rhythm, Stay in Rhythm atrial fibrillation patient conference each year. And it's a 3-day event to educate patients and their loved ones. We have the world's best AFib doctors as our faculty. And not only is it live in person, but we also live stream it across the globe. And we will typically have 30 to 40 countries represented on our live stream. And then we also make that available in our recordings after the fact, and those are available for free in our video library. Last year, we had the privilege to host a special evening with Kareem Abdul-Jabbar for our 10th anniversary. And we're working on our 2024 conference for August, but it's going to be hard to top that one going forward.
I can only imagine. I know for me, I know for me, Mellanie, when I started out as an advocate after my diagnosis, it's almost like, how can what I do matter? There's so many people and so many things happening. And especially for people earlier in the diagnosis, you don't necessarily know how your voice can make a difference. And we got to meet each other in 2020. And, I've learned so much by watching all the things you do. And so
Thank
for
you.
anybody that's on that journey, that you've gone through, what do you want to share with people about how much walking that journey and sharing the experience can really change the future?
So I have a vision that we can rid the world of strokes and deaths caused by AFib. And we can do it by getting people diagnosed promptly and treated properly. Now, that involves health equity, making sure that all people are diagnosed and treated equitably. So for us, the future really means equitable care for all. And so we're doing a lot to drive health equity. First of all, we have a health equity pilot that we're currently running. And for us, we know that rurality, living rurally, is also a disparity, not just the ones you typically think about. So we're actually focused on race, gender, and low-income seniors in rural communities because AFib is most common in seniors, and it's in 5 rural counties in North Texas. And I live in one of those rural counties. So the real challenge for folks who are rural is the impact of the cumulative or compounded disparities that happen over time and over multiple disparities. And that's especially true with inadequate access to care. So let's say a Hispanic woman who is a senior and living in a rural community with less than adequate access to care may have built up disparities over time that can lead to earlier death, can lead to strokes and death from stroke. And so that's something that we're really trying to address. So subsequently, after we finish the pilot in the 5 rural North Texas counties, we intend to spread that to more rural counties in Texas and to the stroke belt of the southeastern U.S. and then beyond across the U.S. Now, recently, we convened a health equity task force, and that's comprised of representatives from 5 major AFib-related medical societies. And the goal is to work together on AFib health equity. We have representatives from American Heart Association, American College of Cardiology, the Heart Rhythm Society, the Association of Black Cardiologists, and the American Association of Thoracic Surgeons. And so the task force identified, some of the issues in AFib care related to disparities and inequities. And one of the first things we had to do is really distinguish what are disparities and what are inequities. So for us, disparities really are differences in health status between groups. And inequities are the disparities that are related to social, economic, environmental, or even healthcare access differences. So we created a call to action report on health equity in AFib, and we released that recently. You can find the background and a link to the report at bit.ly/AF-CTA, and that's for atrial fibrillation call to action. And at that same site, StopAFib.org, you'll find a wealth of other resources as well, including our video library that has more than 160 hours of recordings from our annual patient conference, from our webinars, and from our master classes. Now, the call to action had 8 action steps to address these issues. And so let me run through those very briefly. The first really was to promote awareness and adoption of the new AFib guidelines across all categories of doctors that are actually seeing AFib patients. And that includes not just the electrophysiologists and the surgeons, but also the general cardiologist and even the generalists, the hospitalists, the internal medicine doctors, the geriatricians, etc. So promoting awareness of how to manage and treat AFib is really a key. The second was to educate healthcare professionals on atrial fibrillation care disparities and inequities. Third, promote diversity in the healthcare workforce. Fourth, facilitate training on implicit bias and cultural competency. Fifth, to support underserved communities through advanced patient care strategies, such as atrial fibrillation centers of excellence. And the sixth was to ensure diverse clinical trials. The seventh was to research the drivers of disparities and inequities in atrial fibrillation management. And then the eighth was to enhance shared decision-making and patient engagement in care. And so we're working on the next phase of this project, which will involve some of the action steps that I just elucidated.
Mellanie, I know, so I've been a patient experience researcher for almost 20 years, most of it in cancer. And what we know in cancer is that for patients in rural settings, they have a 10% lower survival rate in the first year than patients who get to go to a comprehensive cancer center.
Right.
And then every disparity is below that. So the starting point in rural cancers is 10% lower automatically.
Yeah.
What is it like working in AFib, and how does the rural setting really impact people?
So one of the things that's so important there is that if you have AFib and if you are possibly having a stroke, you need to get immediately to a stroke center. Those stroke centers tend to be in the cities and in the suburbs. You can't find them rurally. And so the death rate from strokes related to AFib is extremely high in rural communities because you may have to go for 30 minutes or an hour or even 2 hours to actually get to a stroke center. And even the hospitals that are available can be very far away from you in a rural county. My husband actually had a heart attack about 5 years ago. And by the time the paramedics got to him, it was a 30-minute drive in the ambulance to actually reach the hospital. And so time is brain in as it relates to stroke. So not having access to close by healthcare can mean the difference between life and death.
We've learned, Mellanie, through doing these advocacy exchange programs and listening to the community, that the two areas individuals are most interested in is really understanding disparities and inequities. What is that like and what are they dealing with? And then how can they use their voice to create change? And I think the work that you're doing is not only empowering for people to see that work, but it's really pointed at some real and really important things to make better.
Absolutely. And so, in thinking about what I wanted to share, um, it's well and good for us to have done this effort, but what does it mean to you as an advocate? And what are the lessons that we learned that perhaps you can use if you're focused on health equity and even other problems? So there are a lot of big problems to solve, and health equity is a massive problem that applies to most disease states. So what we learned is that we patient organizations have a lot more clout than we think we do. We learned that we could convene a task force with representatives from major medical societies in order to tackle these big issues, and that they would be very supportive of this. And some are even trying to incorporate the call to action work into some of their own work. And so that's very gratifying to have their support and their representatives involved in a project that's so important to us. And then finally, collaboration is key in the work that we do. And there's a lot more work to be done than one organization can do by itself. So having many hands makes for much lighter work.
For me, learning from individuals in different disease areas has made me so much stronger of an advocate across all the work that I do because we share so many similarities in the things we're trying to improve.
Absolutely. And so, one of the key messages that I give to advocates, and I've been privileged to speak at a number of advocacy organization conferences and meetings. And I think the most important thing is if you're on the right mission, the universe will conspire to make it happen. And you can do much bigger things than you ever thought were possible, because you will have help that you didn't know that was even there to help you.
I can feel that you've had that in your life. How has that shaped your life, Mellanie?
Oh, well, the work that I'm doing today is really my labor of love. I believe that one person truly can make a difference. And I have limited time left on this earth, and I need to make the best use of it that's possible. And so, even though people say, you should be retired by now, I'll be 73 this year. I have so much passion behind this mission and knowing that we can make a difference, that drives me. And this truly is my labor of love for the world.
I can't think of a more uplifting or inspiring message to end on and to thank you not only for this time together, but for everything you're doing for your community and to create the future. On behalf of Grit Health and our partners in the Advocacy Exchange, Bristol Myers Squibb, and the Global Patient Voice team, Mellanie, thank you for your voice and everything you're doing to make the world better.
Thank you so much, Dave. It's a real privilege to be here with you and to
Mm,
share what's worked for me and hope that it can work for others.
Very much. Thank you.
Thank you.